I will call the meeting to order. Was the meeting properly noticed?
Yes, it was.
Roll call.
All members are present.
Thank you. May I have a motion to approve the agenda? By Bob, second. Rick? Any discussion? Josh?
Yes, Madam Chair. I'd like to make a motion to clarify. There's a directory list that I'd like to clarify and just list each member individually and their positions in this agenda. And that would be under the Health and Human Services Board. It's on page 3.
Okay, we're just moving for the approval of the agenda now,
Okay,
not the topics that are under it.
all right. I'd just like to just correct these.
There is nothing on the agenda.
It's a directory on here that I'm looking at that it's not clear.
On the
There's
agenda.
double names listed, but they're not clear on their positions.
Are you looking at the annual report?
Yeah,
Okay, that we can address when we get to the. annual
okay, I'll
report.
do it then. Thanks,
Yes.
Madam Chair.
Okay, okay. All in favor?
Aye.
Aye.
Agenda is approved. Approval of the minutes from the May 8th meeting. Motion by Gordy, second
Please.
by Rick. Any discussion on the minutes? All in favor, say aye.
Aye.
Opposed? Public participation? There is none. Correspondence?
None.
None. New business. We have Scott Lowry, I believe, is on reporting for Veteran Service this month.
Hi, good afternoon.
Good afternoon, Scott. How you doing?
Doing fine. So for May 2023, 93 veterans appointments with service-connected VA compensation claims. Research with veterans to file appeals on claims that were denied, file claims for death and burial benefits, handled 247 phone calls and faxes, 500 electronic transmissions, including emails and scanned documents. We did 6 health and welfare checks and meeting with the veterans to complete or sign documents for VA benefits. The 9th of May, quarterly TOMA team meetings hosted by the TOMA VA Medical Center, updates for the last new PACT Act, issues with the comp and pen neurology issues, COVID-19, dental and women's health were the topics. 15th of May, I met with the community action team, mental health, on the transportation committee, just having conversations about how we can improve transportation in the county to get folks to more health. The 17th of May, Veteran Senior Merit Fair at the community center, had 40 veterans come to our booth there, 25 of them meeting appointments to apply for assistance, helping apply for VA healthcare. On the 18th of May, Rick attended the monthly refresher training with the Wisconsin Department of Veterans Affairs. The 22nd to the 26th of May, helping with flag prep, putting flags out in the flag holders for the cemeteries that needed it. And that's pretty much the end of the report.
Are there any questions for Scott? Josh?
Madam Chair, if I may. Scott, Supervisor Pozdolski here. Just had a question on this meeting that took place on the 15th with the rural transportation meeting. I was just wondering if you could tell us a little bit more about what took place in that meeting and how they made improvements to improve the transportation services, what kind of changes they made, and what kind of, give us a little more idea of what tasks these that they fulfill and that the budget for this team is, please.
Unfortunately, I couldn't tell you what the budget is per se. It's a community action team consisting of multiple businesses here in the community. Gunderson, Mountain View, and Family La Clinica, and obviously my office. So as for budget, I don't think there really is a budget. It's just a meeting of folks to get together and trying to improve rural healthcare, transportation issues, and come up with an action or a plan of action to increase awareness of the options for the public. So I don't know if that answers your questions fully.
Yeah, it helps, but can you tell us more about how, people can gain these services, or how they can, basically coordinate and set these transportation services up?
Well, that's exactly what the community action team is doing. We're having those conversations within our organizations, and once that plan comes out, we're better able to let folks know from all between Health and Human Services and Gunderson and all the organizations that are part of this community action team. We're able to lean on each other for information, getting that information out to the public so they know the best way for them to get to their appointments.
Can you tell us about some of the different ways that you notify the public about this? That's, I guess, what I'm wondering, how you notify them.
Well, that would be the patient would call whatever organization, be it a veteran calling my office or someone calling Bonnie Billington at ADRC or Family La Clinica. Hey, I have an appointment. I need to get here on this day. How do I get there? And with our collaboration between the organizations, we would say, okay, this is how you would get there. Call this person, or whatever the case may be, in order for that patient to get to their care. That's how that works. It's just essentially a list within our organizations to make sure that, hey, look, if we can't do it here on our end, here are other options for you to get there.
How much prior notice do they have to make a reservation? And I mean, how much notice do they need to have to get these benefits or this transportation?
Again, the further out, the better, but I think it depends on the organization itself, whether or not they have the ability to take someone to an appointment. In our case here for Veteran Services, if we can't lean on Bonnie Billington, if she doesn't have drivers or she's completely booked up, if that veteran still needs to get there to Toma or to Wausau or wherever, myself or Rick will pick up a veteran and get them there if there's no other way. That's not always the case, because there are times when we have to be in the office, but if it's far enough out, if it's a week out, we're able to react, find a volunteer driver and get that veteran there. But every organization is different as to how they handle getting a patient to an appointment.
Okay.
Thank
So-
you, Scott. I think you probably answered
Yeah.
all those questions.
Can I mention something?
Who is
Madam Chair?
this?
This is Terry. I just wanted to let Josh kind of know that I have a 93-year-old father who is a VA, and we're doing a lot of the services through the VA in Toma. And there's a doctor that comes there, there's a nurse that comes there, there's a psych that comes there. And I don't think it has a whole lot to do with Adams County, even though he's in Adams County, but he does Meals on Wheels also twice a week. But we also have family support that help out, that we take them to all his services. So every case is different when you're talking about a VA person.
Mhm. Yeah, thank you for that, Teresa and Scott. Hopefully all the veterans out there in the county here are getting similar, benefits and, support. So I'd just like to see that, everybody's getting reached. Thank you
Yep,
for that.
absolutely.
Bob, you had a question?
Yeah, this is for Scott. The people that you visited with went from 58 to 93 on this report from last report. Any speculation as to why that increased that much, or was 58 that much lower than normal? And one other question had to do with, Diana, could you move that back toward the top? Oh, I know what it was. It had to do with your appeals. Can you tell us how well that goes for you? I just noticed that you have some claims and you have to do some appeals. So you have any luck with that?
Yeah, let me answer your first question about the increase in the appointments. That increase in the appointments is, that captures the folks that we spoke with at the Veterans Senior Fair at the community center. So that's why that number jumped so much. So it's a 50-ish is about our average for face-to-face appointments. And sometimes it does jump because folks do walk-ins, so we'll have things planned. But if we have a bunch of walk-ins during the week, then obviously our face-to-face meetings are going to increase. As for appeals, again, that's it just depends on the situation. And I would say that we probably have a 75% success rate with appeals. And again, it all comes back to what's the situation with the veteran? How much data do we have to support their claim? And can that veteran get a doctor to say, yes, more likely than not, your illness is caused by your service? And if that's the case, when we go to appeal and we can find a doctor to write a letter that says that's the case, then we win, or the veteran is able to win that appeal and get the disability rating that they deserve.
Very good. I appreciate it. I'm glad to hear you do have a success rate. Thanks.
Yep.
Thank you, Scott.
Yep.
Does anyone have any questions on the financials? You have a question, Josh? Okay. Okay, the financial report just needs to be reviewed and it's accepted. Thank you, Scott, and have a
Welcome.
good day.
You too.
Okay, report of department, review the financials.
Are there any questions for our financial report?
Yeah, I have one on page 5. This is Terry. What has the community mental health grant been used for, as there has not been much spent on it? Page 5.
Sure, this is on page 5. That is our revenue line. So it's more related to what we've claimed. That's generally a grant that we use towards the end of the year. It helps to pay for some residential placements, some case management, services for individuals who may not qualify for other mental health programs.
Does that answer your question?
Yeah. And then on, I don't know what page it was the Brighter Futures Initiative. I think I've asked this question before, but I forgot. Brighter Future Initiatives. What was all that involved?
Diane, are you on?
Okay.
Yes, can you hear me?
Probably asked her before. But I don't remember.
Diane, are you on?
I'm on. Can you hear me?
Yeah, yes.
Okay. The Brighter Futures Initiative is a grant that we do with CW Solutions. And they have a staff member that goes into the school and does what's called the Leo program. And if Terry, I have that highlighted in our annual report, what the Leo program is. So you'll get a chance to, yeah.
You're in
You're,
stereo, so I'll try to
Yeah,
synthesize
you're-
what you said.
Okay.
It's a grant that we are working with CW Solutions. It's geared at providing curriculum in the middle school and high school, geared at brain development, helping to build resiliency. It's a short 6-week course. Diane also has it referenced in our annual report. If you want to reference that, on page 27 of the annual report.
okay, thanks.
Does that answer your questions?
Yep.
Okay. Are there any other questions on the financial report? Okay, seeing none, we will move on to the director's report.
Are there any questions for the director's report?
I have a question for Kelly. This actually is under Children and Family Services, Aaron. Mentioned it's the 5th year of this program we talked about. Is the success rate measurable in any way? Or is it just one of those things that we think we're doing okay?
Erin, are you able to answer Bob's question?
I don't know if I can give you a number for that, but our overall hope is that we'll be able to reduce our teen pregnancy rate and our sexually transmitted infection rate. And what I can say is we have not seen an outbreak amongst our teen population, and Cody could correct me if I'm wrong, of chlamydia like we had experienced in the past. It is a voluntary program, but it also connects young people and anyone who may need it with services that they may not otherwise receive.
Thank you, COVID. I just thought I'd say that.
And that's interesting because there is a concern that not many people have been tested overall for sexually transmitted infections because of COVID, and that chlamydia in particular does not necessarily have symptoms. So that's just information that I'm spreading out there for anyone to use.
I have a question. I don't know if this is the right time to answer it, but at Edward Finance, a resolution came forward to us about Gunderson wanting us to be the financial agent for, I always wonder why, for pharmacy, I always wonder why something like that doesn't come to the committee first and then go over to health and finance, because I think it'd have a little bit more bite if it was approved by the committee previously before going there. What is the reason why that is?
We do have it on the agenda for later today. I think one of the reasons it went to admin FI as opposed to Health and Human Services was because it's a fiscal resolution related to the custodial fund. But I do have it on the agenda later today to make sure we can get some support for it, hopefully.
Are there any other questions?
Yeah, I do, Madam Chair, I'm not quite sure who to question this to, but some of the family care people that are working for elderly people and the disabled and stuff, are they overworked? Do we need to hire more people? Aaron, can you hire more people? I know there's shortage. I mean, that would be underneath Aaron's maybe and Diane's maybe, I don't know, maybe Donna's.
Are you talking about caregivers for long-term support programs for the aging?
Yeah,
Unfortunately, when the state pushed to managed care organizations, we lost control of those programs. So if you're thinking about like Inclusa or, what was Care Wisconsin, they keep changing.
Yeah.
My
Um,
choice.
My choice, those would be questions that those agencies would have to answer.
My guess would be it's the same as everybody else. They're not able to hire enough people to fill their positions, especially in healthcare. Is there anything else?
Madam Chair.
Yes, go ahead, Bob.
Amber Taylor, and this Economic Support Services. As I read this, it appears to be, I guess, questionable citizenship or immigration status, and we have programs for them. And they're eligible to use them until they don't need it anymore. And I have to question in my mind, what the heck kind of a deal is this? I mean, we're just, I guess there's money for people that maybe have come here and aren't legal. But I suppose it's a program, and is that a Fed program?
Amber is not on today. I can bring those questions back to Amber and have her provide some information next month. I know with the unwinding of the COVID policies, some of that is changing. Like today, the drug testing for people with a drug felony in the last 5 years, that was reinstated today. So the drug testing has started for those applying for food share. So some of those policies that maybe were suspended are going back into play, I guess. But to get to your point, I'll ask Amber for some clarification.
Well, I'll appreciate it. I probably won't like it any better than I would have this month, but thanks. If we I still got one more question.
Oh, go for it.
Well, thanks. And this has to do with practical sense. And as I read through that, apparently about 3 semi-loads of clothes that they aren't going to use here will be shipped to Milwaukee and to third world countries, which is a great idea. I also noticed it was a penny a pound, which would equate to about not even the fuel, taking it to Milwaukee. And I guess I gotta get used to some of these programs. I guess that's it. And it doesn't go to the landfill as her point in there, and that's good. We appreciate that part, but anyway, it was noticeable to me, and I didn't know that they did that with the clothes that they couldn't use, so. I mean, she provides us with a profit each year, and so
And
good
so-
for her.
And so you learned something new.
Yes, absolutely.
Very good. Not a wasted day.
It happens almost every day.
Okay. I just have a question for Wendy. I don't know if you're on.
Yes, I'm on.
Okay, I said, I know you had problems when when Echo came in, were changed over to that. Are you expecting better changeover this time? With your changing in systems, is it?
Well, we're not really changing systems. A new company bought the system that we're using. So Therapy Brands has purchased Echo. Echo Group, the Echo Group is what they're called. We're working through the issues. We still have a lot of contact with them, and they've been bringing in, Therapy Brands has been bringing in new staff to manage the technical support. So it's kind of a curve that we're working with them on getting any issues that we have resolved. It's just working with different people, and they're kind of trying to play catch up.
Okay, well, good luck on your change.
Thank you.
Madam Chair, I got a couple questions too, please.
And this is,
Terry,
okay, Terry, go ahead.
one of them was, I've got some friends from the town of Rome that are needing some, at least the advocacy magazine that comes out. It's a flyer. It's really good for Adams County. How do they get on the, are we aware of how many people are actually aged? And need services in the county of Adams? And someone keep track of how many people are out there that are not getting any services?
I'm not sure that we know everyone who is aging. We are connected to those who reached out or we've had to reach out to for various reasons. If someone's interested in getting the advocate, they could reach out to Donna and get on the mailing list. We do know that the advocate is widely shared and a lot of people seem to enjoy it. So if they're interested, please have them get on it. Or if you have a place that you think we should have a couple copies available for pickup, let Donna know.
Okay. And let's see. And then I had a question for Sherry too. If I was just wondering if there was any summer help through the high school students in the special ed program, the EEN program. If any of them are involved in there during the summer at all, are they reaching out for those students that are able to do something?
I don't know if I could speak to that specifically. Sherry's not on the call, but we could get further clarification on that. If you're asking specifically for EEN students.
Yeah. Ones that are still in the school system that have a open summer.
Okay, we'll get some clarification and see if she can add some information to her report next month.
Thanks.
Okay. Yes, Bob?
Yeah, this is an answer for Terry. They have the advocate at the Iron Skillet. Of course, they have it at the library. But if the people in Rome, I don't know if there's something you could put it up there at the Quick Trip or the Dollar General or whatever that is. I mean, maybe they've already got it there, but.
Yeah, it might be valuable to put in the library, I think, too. I don't know if that would help, but yeah.
Is Donna on? Okay. Okay, we'll get word to
Thanks.
Donna. And and your suggestions. So thank you very much.
Yep.
Anything else? Okay. The project status report.
Any questions for our project status report? Later today, we'll talk about fleet vehicles. That's probably the primary project we're on right now.
Okay, see no questions. Aging Advisory Committee. I was not able to attend the last meeting.
I believe it was well attended. They had a very robust agenda, lots of discussion. That is certainly a very engaged committee. Donna reviewed her general reports. One of their focuses is going to be advocacy.
Okay, then we'll move on to the fleet vehicle purchase.
Kyle, do you want to take that?
Madam Chair.
Yes, go ahead.
All right, so we have a quote here from AF Motors, and then we also have one from Napleton Chevrolet. The quote from AF Motors came in at $26,805. If you scroll up a little bit, Lyanna, you'll see on there that we have the paint and fabric protection for $300 and undercoating and rust proofing for $699. Then scroll down to the Napleton quote. The Napleton quote was $26,344.75, but we did not have the paint and fabric protection, the rust proof undercoating on that quote. So if you add in about roughly $1,000 that it was for AF Motors comes in lower than Napleton. And we're looking to purchase 10 Chevy Equinoxes, and we have currently 5 Chevy Malibus and 1 Chevy Equinox. All of those vehicles, they are 20, it's all 2020 Chevy Malibus. I'm not sure the year the Equinox said in 19, Kelly. I think it's
19 or 20.
19, and they are all right around 40,000 miles. We did check with AF Motors as well to see if they would have any sort of trade-in allowance on these vehicles. They were not able to quote a price on trade-ins because it's too far out for when we would actually be trading the vehicle in. Our recommendation is to go forward with AF Motors on the purchase of 10 Chevy Equinoxes.
Questions for this, Bob?
I just, Kyle, we had talked originally about, the income from the other vehicles that were going to be sold and so forth. And of course, that has changed. To what degree has that changed? That's one question. And the other question is, if this is 3 vehicles, then instead of 10, we're up to 9. Is that what I got out of all this? I mean, you said you had 5 and then you had 1, and now we have 3 more. Is that right, or am I way off?
Madam Chair?
Go ahead, yeah.
Yep, so we currently have 5 Chevy Malibus and 1 Chevy Equinox. The goal for the HHS fund for their vehicles is to just be self-sufficient. So we're gonna purchase the vehicles with the government discount, and we're gonna turn them over every 2 years, and hopefully at auction, they go for close to, if not more than what we initially paid for the vehicle after only 2 years of use. So the 6 vehicles that we have right now, we're going to auction those off. And we're getting 10 vehicles. The original plan was to always have 10 vehicles for Health and Human Services, but COVID happened and we have not been able to get vehicles for quite some time.
Well, for what it's worth, I would make a motion to purchase these 3. Is that correct? 5?
10.
And what we have here is the failure to communicate. Well, I want to keep AF Motors in business. If that's our desire and that's what we need, I would move approval for this price at AF Motors.
For the 10, is that correct? Okay, there's a motion to approve the purchase of the 10 vehicles from AF Motors. Do we have a second? Second by Rick. Any, yes, that's what I was just gonna say, discussion.
Couple of things. So some of this money is coming from the year before, correct, Kyle?
Correct.
That's the 5 we've always been waiting on.
Yes.
What is the timetable for these 10? Or is there one?
I'm not sure on the timetable. I believe that AF Motors has been able to place the order, but I'm not sure when they're going to be delivered.
Good luck.
Do we have to have a deposit on these vehicles?
No, I believe they'll invoice us when they arrive.
Okay, are there, Josh?
Madam Chair, if I may. Kyle, these vehicles that we currently have, you said the 5 of them only have about 40,000 miles on them. They're 2020 models. Can you give us some kind of rough idea what these might bring at the auction for resale, just to kind of give us a ballpark or something here to go off of?
Madam Chair,
Go ahead, Kyle.
I'm gonna take a peek at Wisconsin surplus just to see what vehicles have gone for. Oh,
Oh.
sorry. I'm gonna take a look at Wisconsin surplus just to kind of see what vehicles have gone for. I know when this topic came up at I think it was property meeting. There was a 2018 Equinox that sold for almost $20,000 on Wisconsin surplus. So I'm not positive on the Malibus, but the Equinox will probably go for 20,000, maybe a little more than that on Wisconsin surplus.
Okay, appreciate that. So it's about half. You're saying?
Well, the Equinox is quoted at about $26,000. But we are behind on the vehicle replacement schedule just because of not being able to get them in. So yeah, the Equinox is gonna be sold probably for, I think this one was originally purchased for 22,000 and it'll probably sell for close to that.
So we currently have 5 vehicles and we're looking at we're gonna get rid of these 5, we're gonna have 10. So can you tell us why there's a demand for, is it 4 additional vehicles? I'm just kind of having a problem with that here a little bit.
Kelly, could you answer that, please?
Sure. So the vehicles are used instead of personal mileage and using personal vehicles to transport clients. These vehicles, right now we have 6, and we do not have enough vehicles available for staff. So staff spend a lot of their time out in the field doing home visits, sometimes providing transportation, doing meal delivery. And right now, some staff are unable to get a vehicle because they are in such high demand. We have a calendar, we have a reservation system set up, and we are tracking people who are denied their request to use a vehicle.
It seems like these models we've had them, what, 3 years now? 40,000 miles, that doesn't seem like a lot of miles on a vehicle if they're being used that much. So I think that we could kind of consolidate and share these a little bit, it seems, save a little bit. Has that been considered as an option to try to, spend less?
Madam Chair,
Yes.
Kyle, do you want to speak on what our process is here about the 2-year turnaround and also, that warranties and the value of vehicles that we're trading in? And as you can see here, if they sell used for 20 and we get a new vehicle for 6,000, and then also consider the number of miles that are put on vehicles, at the mileage reimbursement rate. So like if we had to pay somebody to use their personal vehicle, what that cost would be versus having a vehicle that we pay basically just $6,000 for to get a new vehicle.
Madam Chair?
Go ahead, Kyle.
Yeah, so back when we first went over to fleet vehicles for Health and Human Services, we did do an analysis on the mileage reimbursement paid to employees. I believe it was $75,000 annually was what we were paying to employees. And what we had initially done was we were gonna go every 5 years for replacing the vehicles under that initial plan. So we were gonna get about 10 vehicles for $20,000 each, which is about $200,000. They were going to last for 5 years, so then essentially the cost was going to be $40,000 a year for the vehicles. So it would net a savings of about $35,000. We've since changed that plan. So that way we're turning the vehicles over every 2 years. We're getting them at our government discount, and then we're turning around and auctioning them off. And the vehicles with the lower miles will definitely go for quite a bit. I couldn't find any examples of Chevy Malibus that were anywhere close to the model year that we have, but I mean, in November of 2022, there's a 2013 Malibu with almost 200,000 miles that sold for over $4,000. That's about the closest example I have for any Chevy Malibus on Wisconsin surplus, but typically low mile vehicles, newer-ish model years, they sell for quite a bit. And right now, we're approaching 4 model years old on these current vehicles.
Rick?
I'd also say when we talk about the mileage, to me is not as big. I believe what Kelly was trying to tell people is when you sign up for a vehicle, that person, even though they may be traveling 10 miles out and 10 miles back, they may be spending 2 hours with a client somewhere tying up that vehicle so somebody else can't use it. And that's how come we need more vehicles, because that way it will free up other vehicles. You heard $75,000, that was 3 years ago. I know the IRS rate has went up since then. So that number would continue to grow if we continue not to get vehicles. And if we could turn them around at $6,000 to $10,000, it's probably more advantageous for us to continue that if we can actually get the vehicles this year.
Josh?
Madam Chair, I appreciate everything there, Kyle, that you presented there. Unfortunately, I just don't believe I'm satisfied with the amounts that we're going to be getting for these trade-in values. We don't really have any idea. And we're looking at doubling our fleet all at once. I mean, I understand ordering issues and such, but this is something that I think we're taking a huge jump on, and it should be more of a gradual thing, maybe a couple at a time, see how it goes, rather than double our fleet all at once. It just seems a little extravagant to me. I don't think I'm going to go along with this, everybody. Sorry.
Okay, does anybody have anything else? All in favor of approving the purchase of these vehicles from Chevy Garage AF Motors?
I,
Opposed?
Nay, Pozdolski.
Okay, the motion is carried. Thank you. Okay, the prescription drug fund.
So this is to Supervisor Pease's question earlier. We wanted to bring the Adams County Prescription Drug Assistance Program to your attention because there was a resolution that was created and brought forward to Admin Finance on Friday related to creating a custodial fund that the county would have, and it would be made up of donations from Gunderson Mountain View's foundation. So earlier this year, we were approached by Aaron Bonnet and his team from Gunderson Mountain View. They wanted to discuss coming together to fill a community need. The local pharmacy noticed a growing need in individuals who were struggling to afford their prescription medications. So a small group of us met. There were members from Gunderson Mountain View, and then some people from the county, including myself, Wendy Pierce, and Kyle Patterson. We had a couple of meetings where we talked about how could we fill this gap? What would that look like? The hospital asked that we hold donated funds here at the county because it would be a conflict of interest for them to hold it because their physicians are most likely prescribing the medications, and it is their pharmacy that is then charging for the medications for a lot of people here in the county. They also wanted to make sure that prescription drug assistance was available to any Adams County resident, not just someone who accessed their services or their pharmacy. So we worked together to create a policy to clarify how to request funds, and we limited the request to $200 per person, a one-time only support. The fund is intended to be used in emergency situations, and it is not considered a long-term solution. Individuals seeking assistance may be able to access other services that may not be known to them when they come to HHS. This fund would be open to any Adams County resident who is working with any pharmacy that would be willing to work with this program. These funds, again, are intended to be a last resort. We are hoping to work with the pharmacists to make sure that they are working with other discount programs, other coupons, and other financial assistance. Gunderson Mountain View's Hospital Foundation has set aside $5,000 to be donated to the program. We have an additional $2,000 from the Jared Aberderis Sal Foundation, which would be earmarked also for this fund, bringing up to $7,000. We know that this is a small amount of money. We know that this is not going to meet everyone's need, But it is a start. The intent is that the funds would be used when they're exhausted, they're exhausted. They would only be replenished through donations, fundraising, or other grants, and no tax levy would go into this program. Are there any questions about the program?
Is this just for information,
This
basically?
is for your information because the resolution was approved by admin finance on Friday, but I know it's coming to the county board later this month.
Okay, just wanted to clarify it. Thanks.
Okay. Josh,
Madam Chair, Kelly, can you tell us why this didn't come through our committee and went through Admin and Finance instead? To be approved for the board?
Madam Chair.
go ahead, Kyle.
Yep, so this is just creating a prescription drug fund. It's a custodial fund, so it's the creation of a fund, so it typically goes to Administrative and Finance Committee. I'll use an example, like in the past, we had a custodial fund for the barn project at the fairgrounds. That one just went to Administrative and Finance. It did not go to property. So we also did have the resolution reviewed by Corporation Council prior to it coming before Admin and Finance.
I appreciate that, Kyle. I suppose that answers my question, but still, I'm not really clear on why some of this doesn't come to certain committees. But
I don't think we can solve that one here. Okay, annual report. Ellie, you want to speak to that?
Sure. So the annual report is linked in the agenda. The document is quite lengthy. It's nearly 60 pages and is only a small reflection of the work that's done at Health and Human Services. You'll find in the annual report an organizational chart, our 2022's department and division accomplishments, division-specific data and utilization information. There's a did you know area along with 2023 department and division goals and survey data for specific programs that are required to have a survey, along with a general trauma-informed department-wide survey. I'm not going to get into a deep dive into the report, but I do want to highlight a few things. On a fiscal note, the department ended the year with a positive balance of $656,156. There are several components that impacted a positive balance, including the challenges we had filling vacancies for hard to fill positions, which caused a decrease in our wage and fringe categories. However, the vacancies also affected our ability to capture revenues for billable services. Preventative and grant programs have also supported our children and families division to be able to keep our out-of-home care costs down. Those are just a couple examples of the things that impact our budget. Our budget is very large, and there are several different things that impact the ups and downs in the budget. We were able to see a 32% increase in the number of individuals served in our psychiatry program. Several programs were able to open back up following COVID program restrictions, including Practical Sense. They were able to bring back their trainees and they were able to re-enter programs as well as opening up our dining sites. The aging and ADRC staff also initiated a restaurant style dining site with success, and we were able to increase our dementia care services. Our coordinated services division absorbed a 36% increase in enrollment for children's long-term support program. Staff are cross-trained in various programs to be able to support the CLTS program growth. Previously, we were able to have a wait list for those services. Now the state is mandating that that is a service that we are unable to waitlist children. The department also felt a 63% increase in our comprehensive community services program over the last 5 years. As a reminder, that program is one of our only fully reimbursable programs for MA eligible services. We were able to maintain more children and youth in their homes through prevention and grant funded services like family-centered treatment and our Teens Initiating Transformation Among Neighborhoods, our Titan group. We also saw increased collaboration across divisions to serve individuals and families in the best possible way. We've absorbed a part-time public health support specialist position into our support services division. And we are continuing to seek alternative funding sources and increase our billable revenues. Some of the challenges that we worked through in 2022, recruitment for volunteers, especially for our transportation and our home delivered meal program, has been very difficult. We're continuing to see rising costs for our services. Staff vacancies for hard to fill positions like social worker, therapist, and service facilitator have been very difficult to fill. And then our program capacity in some areas has been maximized. Case numbers are only one indicator of program capacity. Case complexity is more difficult to measure, and over the past few years, it has increased significantly. We are seeing more complexity in our cases, including family size, family dynamics, housing challenges, homelessness, substance use, mental health issues, criminal behavior, or other family system issues that are impacting individual and family stability. I would just say, despite these challenges, staff and managers have continued to work hard to meet the needs of the community. We're very grateful for our dedicated team of staff and managers who've worked hard every day to meet these complex needs. I know that the report is very long, so if you have any questions, please feel free to reach out to me, and I'd be happy to answer those questions.
Josh?
Madam Chair, I have a question for Kelly. Kelly, can you please tell me more about the residential treatment facilities we currently have in Adams County? I mean, how many do we have? And are these treatment facilities also considered group homes? Do they function in the same level? Is that the same thing?
So Adams County Health and Human Services does not run any residential treatment programs or group homes. As far as group homes for long-term care, there may be a couple adult family homes in our community. If you want a list of those, we could get that to you.
But you have no group homes or any kind of placement centers for any
Are you
mental
speaking
health care or anything like that?
specifically to mental health residential treatment? We do not have that now.
Okay, all right. And let's see. I also had a question about this chart for our crisis patients. I was looking at the adults. Can you pull that up for us, please, Lana? It's towards the end of this report. It's towards, I think it's, actually, I should have just stopped back there because I had a question about that. There's a pie chart. It's at the very end. There, yeah, one more. Okay.
Right there.
There
All
you go.
right. So I see we have voluntary hospitalization. We have all these different admissions. Do you have a number for involuntary hospitalizations? And certainly we have those as well. And I didn't see them in this chart anywhere, this pie chart.
That would be at the bottom where it says emergency detention, 8.6%. That would be your involuntary psychiatric hospitalization.
Okay, is there a way we could clarify that? So, I mean, that's not clear to me that emergency and involuntary are the same thing. Where you have that,
You're asking to separate.
yeah, so we can
involuntary-
maybe motion to change that or amend this to include involuntary instead of emergency.
About all we're doing is accepting this report.
I'm not clear on the voluntary admissions that are in this report here.
I agree with Josh. If he wants to try to change that before it goes to the final board, he can do that. That doesn't, I still should be a motion to change it like he's requesting, and then we can just vote on that, yes or no.
So I'll motion to make that change.
Hold on a minute. Bob had something to say before you.
Is that just wordsmithing? Is that all you want, Josh?
Clarification. It's
That's
not,
wordsmithing, right? I mean, they both
Well,
address the same thing, because that.
yeah. I mean, it's just emergency detention and involuntary admission. It's hard to decipher what that means. That's not clear in this kind of a realm.
Kelly, can I ask a question?
Sure.
So if you look at the bottom underneath emergency detention, it does say there are additional 13 adults that require either protective placement or involuntary detoxification services. Is that all falling on emergency detention? Is that what that is? No.
No, we have our voluntary and involuntary combined in that.
Okay,
So if I understand correctly, if we broke out the 45 adults into 30 and 15, so 30 adults were involuntary and 15 were voluntarily hospitalized, you would be satisfied with that.
That's the actual number?
Yeah.
Okay. Are these individuals being placed then? Involuntarily, if we don't have a center here, I mean, can you tell us where?
I think you've covered that in previous meetings.
I don't recall what
I
what
believe,
was told.
what is it, Oshkosh that has to accept anybody? And they've also mentioned the other hospitals that they.
Is that long term or I think that's just short term, isn't it there? Where do you put the long term patients?
It depends on their needs.
Mhm. Okay. Yeah, it's just not still very clear to me.
Okay, if she splits out so that there is a category there that says involuntary hospitalization, would that satisfy you?
Of the numbers that are, how many, if they're broken down clearly, then I guess I would be satisfied with that, but it's not clear in this form.
We will do our best.
Yes, Bob?
Personally, I don't see where it's not clear myself. I think it pretty much describes what they are dealing with, so.
I mean, an
I'd
emergency,
be in favor of this at all, not changing it.
there's a lot of different situations that could be construed as an emergency versus a actual involuntary commitment or admission.
Okay, Kelly will get back with you on this. As she can't change it right now.
Okay.
And you had another question?
Yes. Madam Chair, that would be back on page 3. We were discussing at the beginning of the meeting.
Right.
Where we had this directory here. They scrolled past it. If Lana could go back, I believe it's page 3.
Mhm.
So there it went. No,
There you go.
okay. I think it'd be more clear if we just put all the supervisors together. Yeah, there was something here that I didn't want to.
But he was at the,
Yes.
There was somebody, there's somebody that was on here.
So Dave Zelinski and Jack Allen were both,
Okay, so we need to just remove those.
nope, they were board members in 2022.
Mhm.
They were board members January through March. So they are represented in here because they were still part of the advisory committee.
All right. Okay, that clears that up. And then I see in the coordinated services report, there were 2 new positions. Can you tell us what those positions entail in a little more detail and the current or the salary for these positions that were approved?
Are you referring to the goal where it stated that the positions were filled?
I believe it was in the coordinated services report. Somewhere in
They
this
were
annual
vacant?
report, there was two new positions that were approved.
So one had been approved in, I can't remember which budget, but it was several budgets ago. And another one had been approved for the beginning of 2022. Your question is the salary?
Yeah, and then what these positions entail a little more, because it's not clear.
Okay, this is an annual report, which is an
Yeah.
overview. It's
Right.
not a detailed report.
Right, I just like to know what they do. General,
That's
It's
one I
not-
think you could take to Kelly after, aside from the meeting,
well, this is why we have meetings,
for information for everyone.
right? And then I guess my other question was on these I don't recall that they were presented and approved by the full county board. Would that have been in this last year?
One
Why?
was in the 2022, I believe, budget, and the other one would have been, I'd have to review which budget it was, but they were in both budgets
Okay,
and approved by the board.
they were, okay. Okay, thank you for that, Kelly. Let's see. Oh, and then there were some examples of the ever-changing policies surrounding the so-called COVID-19. Can you tell us what some of these are examples of some of these policies that have changed?
Sure, we talked about one earlier today with waiving the drug testing requirement for
Mhm.
people who've been convicted of a felony, a drug
Right.
felony in the last 5 years.
Right.
So that was a policy that was suspended.
Mhm.
And at every quarter, when they were reviewing whether or not the pandemic emergency declaration would continue, that there was lots of conversation about how to change those policies. There are several policies that impacted economic support. Those are changing daily, weekly, monthly, as far as how to administer those policies, those practices for programs like food share, Badger Care, childcare, the interview process, the recertification process, that was all suspended during COVID. Face-to-face requirements varied during COVID, whether it was in CSP, CCS, CST, youth and families, you name it. There was quite a variety of policies that changed, whether or not you could see people in person or not. Telehealth policies changed. There's quite a few.
Okay, and along the telehealth, can you tell us how that works and how it reduces the barrier created by technology and Zoom between the patients and the psychiatrist or the caregivers?
How does it, can you rephrase that?
Yeah, can you please tell us more about how telehealth works and how it reduces the barrier created by technology and Zoom, so to get more of an in-person? I mean, we know that there's a barrier created when there's Zoom. And we do lose that human contact and the body language of people. A lot of our communication is,
Madam Chair,
Right.
this ain't part of this.
well, it is because we're talking about telehealth.
No, we're not. We're talking about the
In this,
annual
it's,
report.
well, it's in this annual
And the
report. She just,
topic at the next,
Kelly just talked about it. She was just talking about telehealth.
no, she was talking about the COVID differences.
Yeah, but this is also talking about telehealth in this presentation. And I'd just like to know more about what it does and how it works. And how we're reducing the barrier, because they was talking about how they reduced the barrier of technology also along those lines. So
In
I'm
this
trying to,
report,
It
Yes.
talked about reduce the barriers of transportation and the stigma of coming into the building. I don't want to put our psychiatric prescriber on the spot, but just if you're willing to discuss how you use telehealth for your psychiatry appointments, I think that would be very beneficial.
Okay, am I on? Madam Chair, is that okay?
yes, it is.
Thank you. So during COVID and even since after COVID, we offer telehealth to appropriate clients to complete their psychiatric appointments. It's one example of how Health and Human Services uses telehealth. clients have the opportunity to either call us by phone or we call them by phone. That is not the preferred option and actually the one we use less frequently. There is a platform that Health and Human Services use that clients engage with us on. We can see them, we can read their body language, they can read ours. There is complete face-to-face communication through their entire appointment. I can assess whether or not they're having movement disorder, how they feel, their tone of voice, all of the things. This greatly reduced our no-show rate, both during COVID as well as now afterwards for those folks that can't get into the building to see us consistently, who may not have a vehicle. As we have already discussed, transportation is a huge issue in Adams County. And this greatly reduces those, reduces the reasons for clients not to be able to come in. If a client does not want to do telehealth, they also have that option to only ever do inpatient in-person appointments, and that also works fantastically well. So it is completely client driven as to who has telehealth and who does not.
I'm wondering, would these patients, now we have these vehicles, do we actually go to the patient's house and see them in person if they're, I mean, considered, to have, a need?
We would not currently have the staffing capacity to do that for every appointment because there would obviously be time in between travel to appointments. Justice team has assisted with transportation as needed. Our case managers have when there is no other option, but it is really a last resort because it is time consuming and we don't have the capacity to do that all the time.
Mhm. Yeah, I just have my concerns about not being in person contact with certain individuals, because you lose that body language and a lot of stuff that we
Okay,
have in
Josh,
communication. when
Are
we
you,
Zoom.
you've had your questions answered?
Yeah, I guess I have, and I'm not satisfied with the answers, but thank you, Madam Chair.
Help you there. Okay, is there anything else to come before this meeting? The annual report? Just to send it on to the county board. Okay. Need a motion? Motion by Rick, second by Gordy to move this report onto the county board with the slight change that Kelly's going to make. Is there any further discussion? All in favor?
Aye.
Opposed?
Aye, Ozdowski.
Okay, if there's nothing else to come before this committee, we are in adjournment. Thank you.